Welcome to this edition of The District. I am Joan Garner, your Fulton County Commissioner for District 4. On today's show, we will be joined by Mr. Don Speaks, the Project Director of the Atlanta Promise Neighborhood Project at the Morehouse School of Medicine, Mr. Rob Johnson, Senior Vice President of the Atlanta Community Food Bank, Camille Nouri, who is the Child Fitness Consultant with the Atlanta Promise Neighborhood, Dr. Ruby Thomas, Assistant Professor in the Department of Community Health and Preventive Medicine at the Morehouse School of Medicine, and Ms. Charmaine Godley, who is the Director of Education, Quality Improvements, and Community Engagement for United Way of Greater Atlanta. In 2010, the Atlanta Promise Neighborhood, which we will call APN, was established with support from the U.S. Department of Education. APN is a long-term collaborative, holistic community revitalization initiative focused on providing a safe, nurturing environment to help change the educational health and social development outcomes for children and their families living in Southwest Atlanta through a continuum of solutions. Their collective belief is that intergenerational poverty, educational failure, malnutrition, lack of opportunity for physical activity, substandard housing, crime, and mental and emotional health issues within the family context of school-age children are the primary barriers to their ability to thrive academically and lead healthy, productive lives. We have a great show planned. Don't go away. We'll be right back. Welcome back to the District. We have a great show planned for you today. I am Joan Garner, your Fulton County Commissioner for District 4. Joining us today is Mr. Don Speaks, Mr. Rob Johnson, and Mr. Camille Nouri. Gentlemen, welcome to the District.
Thank you.
Thank you. Thank you.
So Don, let's start this conversation with you. What is the Atlanta Promise Neighborhood and where is this community?
Atlanta Promise Neighborhood is a collaboration of a number of different organizations that come together during the time, 2010, to see what we could do to help the Atlanta public school system in its quest to right the ship and to do a better job of preparing children for a successful life. Early in the work, we concluded that there are issues in the community, at the School of Medicine, we call them social determinants, that are barriers for children's ability to learn and thrive in school, no matter how well the educational approach may be in the classroom and no matter how great the teacher is. And we focused on access to health care, and we call that our medical home initiative. We focused on family food security. Many of our children, families, Mr. Johnson will mention this, I'm sure, there's data that says a lot of kids who live in communities like this miss as many as 27 meals a month. And we looked at fitness. This was during the time when the discussion about childhood obesity was raging, and the work that Mr. Nouri was doing when he was running Arthur M. Blank Family YMCA, that's scientific and it's multifaceted. We brought all that together with the intent to help APS move forward and do what they have to do. We have one other component of our initiative, that's parental involvement. Quite frankly, it's the most challenging, but we discovered some interesting ways to capture the attention and to motivate many of our children's parents to get more involved in their life.
Great, thank you. So Rob, this leads me to my next question. There are references to collective impact and how it inspired this project. Who are the partners in this collaboration, and are there plans to expand this project to other school clusters?
Yes, indeed. Well, the partnership began when the Obama administration put out this funding that was available for study grants and implementation grants. And the great news here in Greater Atlanta is Morehouse School of Medicine and the United Way of Metro Atlanta, Greater Atlanta, agreed to be the co-applicants for that grant. But as they were developing that, we were already doing some very piloted collaboration that included the nearby YMCA. We at the Atlanta Community Food Bank have been involved in those neighborhoods for years. The Fulton County Health Department that had and still does have a neighborhood facility but was not getting utilized much was eager to come to the table. And certainly, again, the Atlanta Public School System was going to be the anchor of it. So those were some of the beginning ones, but we'll have to say from the time we began, and particularly in that pilot year of coming together, there were many other players and social services providers that have come to meetings, come to the table, and for sure I think we're not locked into one set of partners. But all along the vision was, let's start with these Vine City, English Avenue, West End area community, demonstrate if we collectively work together and collect data that will make a difference. And by all means, the vision has been, let's make this hopefully replicable to then other parts of our greater Atlanta area.
Great, thank you, Rob. Camille, welcome to the show. Don and Rob have already explained the foundation of the APN and how this initiative is structured. So would you tell us, please, how were the interventions that compose the APN chosen?
Well, based upon the need. I can speak with the fitness component more specifically. We know that these kids are health risks. We know we have quite a bit of children in elementary schools within the Washington cluster that are health risks. We know that 25% of the kindergartners that we assessed or tested are entering school already at health risk. We know that 34.5%, nearly 35% of fifth graders are graduating and leaving elementary school into middle school already health risk. So we know that it's regressing instead of progressing. And so it's all based upon identifying what are the needs of the areas, and what's so unique about this is that it is needs-based, and that Dawn and the team has assembled a bunch of community leaders, providers to address those needs: education, health, and nutrition with Rob, early childhood education with Charmaine, and many others. So it's all based upon the needs of the community, and whatever they are and whatever they may become is to identify and resolve those issues as much as we can.
Great. So over the last few years, we've heard a lot about childhood obesity, and we know that this was really brought to the forefront by First Lady Michelle Obama and her Let's Move initiative. And so how does the work that you all are doing with the Atlanta Promise neighborhood address the issue of childhood obesity? Any of you?
All of us can make a contribution to that. Yes. One thing we know is a lot of children that live in communities like this don't have access to a healthcare provider. So we want to make sure that all of our families and the children that attend our schools have access to a medical home, no matter where it is, but they have access there. The other component of this is the nutrition piece. A lot of kids just don't get food. I mentioned that earlier. And then a lot of kids eat a whole lot of the wrong thing. And then in communities like the Promise neighborhood community, the kids come to school and they go home. There's no play in the street, and the things that those of us that have a few more years on us, it was all part of our growing up. You don't see young people doing that now. So we looked at those pieces, and it become pretty much obvious that if we could get those things together, that we'd be giving the Atlanta public school system a better child to educate.
Camille, I know that. Sorry.
Well, I'd say two other dynamics around the whole food and nutrition issue is from studying all over the country, we're very fortunate that the head of nutrition for the Atlanta public school system, Dr. Marilyn Hughes, has been a key partner in here. Within the school system, there's been great effort to improve the nutrition quality, get fresh fruits and vegetables introduced into snacks for the children. So that's been a help. So exposing kids to the better food has been very helpful. But the other dynamic is we know that people who are food insecure and are limited in income, just to make the economics work, often are doing the best they can, but are ending up buying very high carbohydrate meals to sustain them. So we are getting more and more nutrition education into the classroom, but then now are branching into how can we do nutrition education to caregivers so that they'll better understand, hey, if you're unlimited, here's where you can get good deals using SNAP benefits and things like that.
Thank you. Camille?
In simply, we know that these kids they don't have the ability to exercise. And the school systems, with their, focusing on education, the kids really don't have time throughout the school day to engage in, but we used to have physical education every single day. So the idea is to try to engage them in 60 minutes of physical activity during the school day. So one of the things we're talking about doing is doing things early in the morning. So we're hoping that kids would choose to exercise before the school bell rings, that we can do some brain breaks activities inside of this classroom. Look at how we can introduce some type of activities during lunchtime, after school, so on and so forth. So the idea is to engage the kids in physical activity, which complements what Obama's doing, Michelle Obama, with the Let's Move campaign.
Great. So Don, Robin, Camille, thank you so much. This is very interesting conversation.
Thanks for having me.
When we return, we will continue our discussion about the Atlanta Promise neighborhood with Mr. Don Speaks, and we will be joined by Dr. Ruby Thomas from the Morehouse School of Medicine and Ms. Charmaine Godley from the United Way of Greater Atlanta. You are watching The District. Stay tuned, there's more to come. Welcome back to The District, everyone. I am Joan Garner, your Fulton County Commissioner for District 4. If you've just tuned into the show, we are having a discussion about the Atlanta Promise neighborhood with Mr. Don Speaks, APN Project Director. And now we are joined by Dr. Ruby Thomas, who is an assistant professor in the Department of Community Health and Preventive Medicine at Morehouse School of Medicine, and Ms. Charmaine Godley, Director of Education, Quality Improvements and Community Engagement at United Way of Greater Atlanta. Welcome to the show, everyone.
Thank you.
Thank you.
Dr. Thomas, could you explain to our viewing audience why it is so important to make health a priority in this work?
Sure. I mean, health is definitely a priority. I think we can all agree that, if we don't have our health, we don't have anything. So I think healthy communities start with healthy families. So children have to be healthy. They have to be present in school to learn well. And they can't do that if they're missing days from acute and chronic illness. Mothers and fathers have to be healthy to parent effectively. And we're talking physical health as well as mental, social, emotional, and financial health. So I think by addressing all those arenas of health, you put the community in a place to make a sustainable and positive change.
I think that's great. I always say when we have healthy communities and livable communities, we have a healthy county.
Exactly.
So thank you. So as we all know, there are several social determinants that factor into a person's overall health and well-being. There is a lot of conversation about early childhood development being a place where substantial improvement can be made with educational outcomes. Charmaine, what is this concept of early childhood development, and how does this collaboration with the Atlanta Promise neighborhood seek to improve those outcomes?
Well, first, I want to state that the research shows that 90% of brain development takes place before the age of 5 years old. So within our partnership with the Promise neighborhood, we are being proactive and being on the front end of doing the, not an intervention, but a prevention, so that we have early childhood, early literacy, which leads to success in life for young children. United Way specifically is supporting in the Promise neighborhood and quality initiatives. is quality improvements is working with the child care centers so that we are supporting that window of birth to 5 years old so that we can help them reach quality. And then that's sustained by our other state partners, so we get them to that part and then they take them on with incentives to the next level to make sure that they have the highest quality child care.
So collaboration can often be difficult, as we all know, when working across sectors and disciplines to address community needs. Charmaine, could you please tell us what strategies have been put in place over the past 4 years to allow for effective and efficient collaboration among all of the partners who are involved?
Specifically, we look at the collective impact model, which is very strategic out of Stanford University. But it has some components that I want to highlight specifically, which is continuous communication. And I think aligned with that are courageous leaders. We have courageous leadership that is involved in this collaboration. So people who have tenacity and are committed to doing this. The other thing is we have a common agenda. That's one of the other components of collective impact. We all want the best for the children in this community. And then, not the final one, but the third one is alignment and integration of activities. So we all bring something that helps to support the whole child and the whole family.
Great. So I am certainly glad to know that Fulton County has been a valuable partner in this work, and we have heard about how our Department of Health and Wellness has been engaged and continues to serve as a resource for the Atlanta Promise neighborhood. So after all, you are why we are here. Don, could you tell us more about some of the outcomes that have been realized since partnering with Fulton County?
Oh, we've got access to flow of residents who are traditionally hard to get to. You know, one of the characteristics, you were speaking about the social determinants, a common characteristic is poverty. Poverty has its own culture. And many people, after having been through years of disappointment, rejection, they just sort of become very hard and they figure out how to survive without using the resources that good people in Fulton County provide for them through all the many different aspects. So working with Fulton County Department of Health and Wellness has given us a very strategic position in the heart of the community.
So we've had a lot of good information that has been discussed here today. Would you let our viewers know how they might be in touch with you in the Promise neighborhood? Any contact information, and if there's any more information that you think our listeners and viewers should have, please feel free to share.
Okay. I'll share one phone number. It's 404-756-8856. That's the Promise Neighborhood phone line. Charmaine mentioned communication. We're not slow to get information out in the right hands of people that the questions or comments may be directed towards. And I want to mention one other component of this. We share the corny vision that we're still focused on, but that by the year 2023, every child that lives in the Promise neighborhood area will be on their way towards being a productive citizen in the city of Atlanta. And there's 3 benchmarks that we're looking at: improving student attendance. Dr. Thomas mentioned if you're not at school, you can't learn. Improving student behavior through our nutrition and exercise stuff and making sure children are well behaved when they go to school so they can stay in school. And ultimately, all of those things should impact academic achievement.
Great. Dr. Thomas, do you have some thoughts for us?
I'll just say health is wealth. So that's what the Promise neighborhood is focused on, making healthy, wealthy families for the community. So.
Great. And Charmaine?
And in response to your question about a number, I would give the information of United Way of Greater Atlanta's 211 that focuses on our 4 focus areas: income, health, education, and homelessness, so that families can reach out to dialing 211.
And so, Don, would you let us know just briefly the strategic vision? What's the plan for the next 4 to 5 years with the Promise Atlanta Promise neighborhood?
the first 3.5 or 4 years, we've been working on piloting these interventions that we've discussed here with you today and determining how we can best do those at the different schools. Each school has a different personality, each community has a different character. So we've got a pretty good idea about how to execute these interventions. Moving forward, starting this fall, is we're going to be implementing all of these things incrementally, simultaneously in our 6-school cluster area.
Great. Well, this again has been a wealth of information, and I really appreciate that you've taken the time to come and share that with our viewers today. So, Don, Dr. Thomas, and Charmaine, thank you very much for joining us here today on The District. When we return, I will share my closing thoughts. We'll be right back. Welcome back to The District. I am Joan Garner, your Fulton County Commissioner for District 4. Today we discussed the Atlanta Promise neighborhood with Mr. Don Speaks, Project Director with Atlanta Promise Neighborhood Project at Morehouse School of Medicine, Mr. Rob Johnson, Senior Vice President of the Atlanta Community Food Bank, Kamel Nouri, Childhood Fitness Consultant with the Atlanta Promise Neighborhood at Morehouse School of Medicine, Dr. Ruby Thomas, Assistant Professor with the Department of Community Health and Preventive Medicine at Morehouse School of Medicine, and Ms. Charmaine Godley, the Director of Education, Quality Improvements, and Community Engagement with the United Way of Greater Atlanta. Through unifying stakeholders under a common agenda and building upon community assets, APN is determined to shift cultural norms and empower community members to take action for the future of the community. APN employs a child-centered, family-focused, and school-based approach to improve student attendance, behavior, academic performance, and health. APN interventions specifically address 4 target areas: quality health care, nutrition and food security, physical activity promotion, wellness, behavior, and role modeling. The APN is comprised of stakeholders from across different sectors, such as business, housing, child care, education, fitness, and nutrition, who have lived and/or worked in the APN area for many years. The APN Collaborative Coalition is grounded in 2 principles: collective impact and results-based accountability. We are excited about the work they are doing to build healthy and vibrant communities. We look forward to playing a significant role in this initiative for years to come. As I always say, healthy citizens make for healthy communities, which make up healthy counties. I want to thank my guests for the helpful information they provided us today, and thank you for joining us on The District. That's our show for today. Feel free to contact my District 4 office anytime by calling us at 404-612-8226. You can email us at district4@fultoncountyga.gov, tweet with us at ComJoanGarner, and of course, friend us on Facebook. Until we meet again, I am your District 4 Fulton County Commissioner, Joan Garner. Thanks for watching The District.